It's time for PetSylvania with Dr. Bob Esplin. Dr. Bob guides you through the latest veterinary techniques and procedures to keep your pets in the best of health. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. With your ears up and tails wagging, here is Dr. Bob.
Hello, pet lovers. Dr. Bob. I appreciate you tuning in to PetSylvania. Here we are right after the 4th of July and midsummer, and I'm still here broadcasting and having a really good time doing it. I'd like to thank my sponsors, Esplin Medical, the makers of the most unique surgical scrub on the market. They are so comfortable they can be worn as pajamas, so you don't have to be in the medical profession to wear Esplin Medical scrubs. You can purchase them at Sylvania Vet. We have the full line. You can purchase them at Toledo Family Pharmacy. They carry the Caribbean blue and the navy blue in the full line plus the jackets. And you can also buy them online at www.esplinmedical.com. They are environmentally friendly. So in addition to being comfortable, you're just a regular environmentalist. So you'll be known as a tree hugger. Elanco, the maker of Trifexis, the premier product for flea and internal parasite and heartworm prevention. It's a once-a-month pill. It's truly the most unique innovation in this area of veterinary medicine in a good many years, probably since the topical flea control products came along. We're now doing it with a pill, and just gets easier. As a result, it gets more effective as well because it's easier to do. You don't forget. It doesn't have to be application dependent, and so it's just it's going to work better for you. Hills, the makers of Science Diet and Prescription Diets, a truly science-based nutrition company. They don't just make food. They study the nutrition and the science of nutrition and make diets based on the principles that they have learned. The full line of Science Diet products, meet every niche of food group that you might be interested in, from puppy food to large breed puppy food to adult maintenance to large breed adult maintenance, and any number of all natural, really a line of grain-free foods to meet that niche. And then, of course, Sylvania Vet, my office, we're considered the best in the community, and we constantly strive to improve on that being the best. We're not resting on our laurels. We ask you to come, take a tour, meet us. You're going to encounter a brand of veterinary medicine like you never encountered before at a facility that's designed to provide 24/7, 365 care for the simplest of cases, for the most complex of emergencies. We're there for you. We do routine wellness exams on a daily basis, as well as manage difficult cases and refer to the specialists when we feel it's beyond our capability. But we can do things that most general practices in the area cannot do or don't want to do, that they're more happy to get rid of a case and turn it over to a specialist. We got a question. Love it when we get these questions. So please, send those off to me. Jim wrote, my 5-year-old Bichon Mix is a barker. He barks at everything and everybody. I can understand him barking at strangers, but he barks at the family members, even to the point where he sees them go into the bathroom, and when they come out, he barks at them like he's never seen them before. Is there anything we can do to stop this barking short of a lobotomy or a tonguectomy? Well, Jim, we're not gonna recommend those, and even something that seems to make sense called a laryngectomy, where you remove the vocal folds. That the debarking procedure is no longer considered humane, and so that's not even available. You have a training issue here, obviously, and you have to figure out a way to get around that. And it's not something that we're going to solve on a 1.5 minute question and answer period on air. But the reality is that I would start seizing control of your dog and making him earn everything he gets. You might want to get him fitted with a gentle leader collar so that you would have a little better control of him in the house, and you can deal with him when he starts to bark. And they make some non-shock type barking collars. There's a citronella collar called the ABS system, the anti-bark system, that might work as well as a negative response to barking. So give those a try. Give us a call, 419-885-4421, and schedule a behavioral consult. And I'm the doctor that does most of the behavioral consults. I find it really interesting and challenging to do that. If you listen to a lot of TV and radio ads for dog foods, there's a great deal of emphasis on protein content, high protein and meat sources for protein and everything. And the reality is that there are certain minimum protein standards that must be met for growth and for maintenance in adult dogs and cats. You can do too much. You can't eat just a protein diet. You can't, your dog can't, even your cat, who's more of a carnivore, can't eat just a protein diet and have a balanced diet and remain healthy. But puppies should have between 22 and 25% protein in their diet. Adults should have between 8 and 15%. So 8% is pretty low. I think that most of the diets that I look to recommend are up in that 13 to 15% protein. Kittens need 28 to 29% protein, and adults something over 21% protein, but not approaching that 28%. What happens if you feed too much protein? Well, the cost of your food goes up because protein costs more than carbohydrates and fat. Protein in excess cannot be stored, and so the liver must work on it to break it down, and it moves a nitrogen molecule, converts that into urea, and then converts the remaining portion of the protein molecule is carbohydrate, and then that's either utilized or it's turned into glycogen. Or the magical thing as to what happens when there's no more room for glycogen, carbohydrate is converted into fat. And once fat's there, it's not going to go away. So remember, protein can't be stored, so excessive protein is not necessarily good. In the aged animal, dog or cat, the excessive protein may also be detrimental to kidney health. Another thing that you need to pay attention to is that when you read a bag of food, the description of the diet is on there, and if it says that it's good for all life stages, that means it's a puppy food, and that means it's going to have too much protein in it. It's going to have too much calcium, too much phosphorus. It's not a healthy diet for an adult, and it's certainly not a healthy diet for a geriatric dog. Puppies will play hard sometimes, and they like to play catch, and they like to play fetch retrieve, and they tug of war. And sometimes those baby teeth, which aren't the strongest teeth and they aren't as strong as adult teeth, get broke. What happens? Well, it's almost always the big canine teeth, the fang teeth, those sharp ones that hurt when those puppies bite you. They should be dealt with They need to have what's known as a pulpectomy, where the root is removed and it's sealed up, because if you don't, you leave a pathway open for pain, and you leave a pathway open for infection. And if you try to remove that tooth prematurely before the adult tooth starts to erupt, then what you can do is damage the adult tooth so that it doesn't come in properly, or may not even erupt, but it ends up being buried up in the jaw, where it can cause lots of problems. So don't ignore a broken baby tooth. Most puppies start losing their baby teeth. They lose the front ones at about 4 months of age. The adult ones start to come in, and the canine teeth start to fall out by about 5 months of age, and they're all the way in by 6 months. And that baby tooth should be gone by the time those adult teeth are all the way in. If not, now an extraction needs to be done. It's time to take a break, and we'll be back. Owners of white dogs, particularly Maltese and Bichons, are confronted with the unsightly occurrence of a reddish-brown stain that goes down the edge of the nose and comes out of the eye, and that's a tear overflow. It's really unsightly, there's no question, and tear overflow can occur in other breeds of dogs. It just isn't as obvious. In addition to the cosmetic component of tear overflow, the skin can be chronically moist, and that can set it up for the development of skin infections, either from bacteria or yeast. And I've actually had dogs come in for treatment where the skin has been so infected, the whole face of the dog smelled. Some of the dogs with like pugs and English bulldogs can have some tear overflow, and now they have folds on their face, and those folds get moist, and that can be a source of unpleasant odor and discomfort for the dog. Some of the causes of the tear overflow is that there's a condition where the lower lid and the upper lid as well, but usually the lower lid will roll in, and that's called entropion. The hair contacts from the lid contacts cornea. Cornea then gets irritated, and that causes tear production, because we know what happens if we get something irritating in our eyes, and that can cause the excessive amounts of tears that overflow. Extraneous hairs in the eyelid margins, called dysdachiasis, can also happen. Animals can have plugged up tear ducts for a number of reasons, and one of the things that we do when we try to figure out exactly what's going on is we flush those tear ducts out, make sure that the upper duct, the lower duct are open, and the tears flow all the way into the nostril, so that when we cry, our nose runs, and the reason is because the tear duct drains into the nose. And then there are some tear stain products that you can buy. We have a product called a tear stain chew. It's a chewable cube that you give to your dog, and it changes the color. It doesn't reduce the tear overflow, but it does in fact change the color so that it's not so unsightly. And then there's some wipe that you can use that also helps clear. There's a product called Clear Eyes on the market, and that's been proven to not be very effective. So this is something that your dog doesn't have to live with, and you don't have to look at looking like we've got a football player ready to go out with the eye black under the eye for competition. We don't want your dogs to look like that all the time. There's an article in the Blade recently about introducing your baby in a dog in the house, and I think the key is you start early with by getting the dog ready, keeping it out of the nursery as you prepare that. Teach them that that's off limits. Train your dog to not get up on the furniture, so that they can have some privacy with the infant when it's there. When the baby's born and it's in the hospital, bring home a dirty diaper and let it get a good sniff of that, and bring home a blanket and get a good sniff of that, and rub that blanket all over the dog so that it's getting used to that baby's scent. Give the dog not the same kinds of attention it got before that baby came in the house and really disrupted things. And then use common sense. Don't leave the baby laying on a blanket on the floor when the dog, who's a rampager, runs around the house when the doorbell rings. And when people come to visit and see that new baby, make sure that they greet the dog, because they always did before. If you do that, there's almost never a problem when you bring the baby into the house. And most dogs act as pretty good watchdogs for the baby when it starts to cry and carry on. They want mom to come and pay some attention. But during that infancy period of nursing, the dog needs to be off in another area away and not part of that nursing or that feeding time, which is bonding time for mom and dad and the infant. Liver disease is one of the most complicated problems that we deal with, because it seems like every step along the way we need more information. So we start by saying, well, how is it that we suspect that an animal has liver disease? Well, they may or they may not have jaundice. Yellow jaundice. We've heard of that. They get yellowing of the eyes. And if a dog, it's pretty obvious that we probably have a liver problem if your animal has yellow jaundice. But other clinical signs could cause for an increase in water consumption, a decrease in appetite, weight loss, vomiting, and diarrhea are some of the early signs that we associate with that. Lab work, then, there's about 6 parameters that we look at, tests called the GGT and the ALT and the AST and albumin, and a couple of others that we look at that help point us in the direction if we're dealing with liver diseases. But it still doesn't tell tell us why that liver is affected, and so it doesn't tell us if the liver is working normally or not. So we run a test called a bile acid. Once we learn about the bile acids, then we may need more information. And so the liver keeps saying, do more, until you can get a precise diagnosis. But the precise diagnosis enables us to fine-tune treatment and put it right on to the cause of the liver problem, which should make it ultimately faster for the dog or cat to recover, and means that it's going to get returned to health more quickly. We use products called Denamarin, which is a liver protective product, and you may need to use a special diet made by Hills called LD, depending on the stage at which the liver disease has reached in your pet. So don't get frustrated when an answer is given to your question, well, I don't know, we need to do more. The liver disease is definitely one of the things where we need to do more. It's important to remind you, and most of you know, that dogs should be taking monthly medication year-round to help protect it against heartworm disease. That's where Trifexis fits in as a part of the heartworm preventive program. But many of you with cats don't know or recognize that cats get heartworm disease as well. And even cats that are strictly indoors are at risk for heartworm disease. And as a result, they should also be on heartworm preventive. There's no good treatment for heartworm disease in cats, so prevention is really the primary approach to that problem. The drug of choice that we feel is called Revolution. It's a topical. It also protects them against fleas and a few ticks, so you get a double benefit, triple benefit out of the Revolution. And the Revolution's most effective method of thing that it does is to prevent heartworm disease. So we feel that all cats, whether they are indoors 100%, indoor-outdoor, or they're totally outdoor cats, should get a dose of Revolution every month. When you buy Revolution from the veterinarian, if you buy 6, you get 2 free. That's a pretty good deal. Caged birds and rabbits, some of the exotics that we take care of. And I want to just mention in brief that an awful lot of these caged animals that we see are frequently malnourished. And the reason being is that the owners are not getting good advice from the pet stores when they buy it, and they're not bringing the animals in for a consult on nutrition and other husbandry issues on these animals. And as a result, what we see then is birds that don't live as long as they should, birds that develop fatty livers, rabbits that have digestive problems, that develop hairballs. Key is that most people are feeding the rabbits just a big dish, unlimited amounts of pelleted food, and their birds are being fed a seed diet. They're constantly replenishing the seeds, and so as a result, the bird isn't forced to eat all the seeds, and so they're eating an imbalanced diet. They're generally only eating the seeds that have high fat because they taste the best, and so they're really not healthy. And feeding a diet that is not only has seed in it, but also has pellets in it. And in a rabbit, feeding some pellets, but feeding a diet that is really heavy into Timothy hay is really the best way to feed a balanced diet to your caged pet. So we encourage you to bring those animals in on an annual basis, just as you would your dogs or cats, because it's important that even if we're not giving vaccines, there's lots of things to talk about and assess the overall health of your caged pet. That's birds and rabbits and your reptiles and your ferrets and even the guinea pigs and the chinchillas and the hamsters. We see them on a regular basis at Sylvania Vet. pretty much everybody that listens to PetSylvania know that I had a triple bypass surgery on March the 20th and that I'm still recovering and in rehab even though I'm back to work. And the other day at rehab, they gave all of us that were there a quiz to see what we knew about exercise. So I thought it might be useful for just my listeners to know about this quiz. And then next week, we're going to give you the answers. So let's see how you do. Question 1, as we go through this, what should you do before and after exercise to help prevent injuries? Next question, what are some common symptoms or problems that would cause you to stop exercising? How do you check your pulse? Should you exercise 7 days a week? Should you go home and exercise the days that you're in rehab? In other words, those of you that aren't in rehab, but should you exercise hard every day? What kind of weather must we be aware of when you are exercising? Heat, cold, humidity, all of the above? During the summer, what would be the best time to exercise? Noon, early morning, late evening, early afternoon. You should eat a light meal or snack 1 to 2 hours before exercising. Yes or no? Symptoms of low blood sugar may include shaking, anxiety, hunger, weakness, dizziness, all of the above. Exercise raises or lowers blood sugar. Which of those is the correct answer? Probably couldn't get them all written down, so you can go on our website, www.sylvaniavet.com. By early next week, it'll be archived there, and you can bring up the July 7th PetSylvania, and you can listen to those questions, and then you can answer them. If you want to then send those to me at requests at WSYLradio.com. We'll take a look at it, and those of you that get all the right answers, I'll send you a little award. You can kind of learn from my rehab about some very important exercise principles. I'd like to thank Elanco, the makers of Trifexis and other high-quality veterinary pharmaceuticals, Hills, the makers of Science Diet and Prescription Diet, their newest entry into the prescription diet, the game changer in pet weight loss, Metabolic Diet. If your pet is overweight by more than 10%, and most pets are, believe it or not, then Metabolic Diet is something that you should learn about. Esplin Medical, the makers of Comfy Scrubs, 55% bamboo, 25% cotton, 20% polyester, environmentally friendly, renewable resource is used for 80% of these scrubs. The remaining 20% in poly is used recycled plastic bottles, so we're getting some value out of that discarded product. And Sylvania Vet, emergency service. It's unique to us. We are the only general practice in the area that's providing 24/7, 365 care, hospital staffing, a doctor on call, and emergency service. Saw a sign the other day where a practice says, we're open on Sunday from 5 to 6 to pick up boarders. Well, whoopee, we're open 24/7, 365 to drop off or pick up boarders. It can be arranged, and there's nothing special about it. And remember also that those animals that were there until 5 or 6 o'clock were there alone because there's nobody there overnight or after hours on the weekends. Those are important things for you to think about. We have an Adopt-a-thon coming up Sunday, July 14th from 12 to 3 at Sylvania Vet. We'll have area rescues there with animals looking for forever homes. So come see us, and we'll welcome you with open arms. There's going to be door prizes, and we're serving soft serve ice cream to everybody that attends that day. So you want to come to our Adopt-a-thon July 14th. Thank you very much for tuning in to PetSylvania. There's only one greatest pet, and it lives in your home.
You have been listening to PetSylvania with Dr. Bob Esplin on WSYLradio.com. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. Tune in every Saturday at 10 a.m. as Dr. Bob explains the latest in veterinary care and answers your questions. You can email your pet questions to requests@WSYLradio.com, and Dr. Bob will answer them on a future show.